was better when I got Our first speaker for the night, I gotta put my glasses on, is Jackie Stockton. Jackie has been a Toastmaster for 3+ years and has achieved her Competent Communicator status and is currently close to finishing her first Competent Leadership Award. She enjoys reading, listening to music, and anything to do with history, especially British and American civil history, which seems to be very abstruse, I'm sure. But it would fit in good with the history. She has worked in the healthcare field since 1970. She currently manages the medical transcription department at St. Mary's Mercy Hospital in Livonia, and is one of the first hospitals in Michigan to adopt a senior ER, which Jackie is going to tell us about today. Jackie's speech tonight is Project 1, the speech to inform. From the advanced manual, Speaking to Inform, the speech will last about 5 to 7 minutes and is titled Senior ER. Welcome, Jackie Stockton.
Yes. Thank you, Mr. Toastmaster. Do you feel a bit older this year? It's not your imagination. We're really all getting older. But not only are we getting older, the world's population is getting older. The Department of Health and Human Services tells us that in the year 2000, there were 12% of Americans who were age 65 or better. But by the year 2030, which is only 17 years away, that sounded very futuristic when I first read it, and then I did the math and thought, goodness, that's a decade and a half from now. There will be 19% of Americans that are 65 and older. That's a major population shift. That's happening around the world. As a matter of fact, the International Labor Organization, the ILO, has said they recommend that the retail industry focus on attracting and retaining employees 50 and older. Doesn't that sound good to a few of us in the room? Especially in the sales arena. Things are getting different in this world. Mr. Toastmaster, fellow Toastmasters, and honored guests. With the world's population changing, many changes are going to occur in every industry. One thing I found out too is that even China's workforce is aging because of their one-child per family policy. So their workforce is shrinking as it ages as well. There is one industry that I think will feel the most impact, and that is healthcare. The reason is, number one, Obamacare, better known as Obamacare, but it's truly the Affordable Care Act, ties Medicare reimbursements to patient satisfaction surveys. Did you know that? Patient satisfaction surveys and patient readmission rates. Patient readmission rates means that if I'm a patient and Hospital A discharges me today because I am well, but within 30 days I am readmitted to Hospital B, C, or even A again, Hospital A will forfeit some of their money from Medicare because they should have taken better care of me and had me leaving in much better condition so that I didn't need to be in a hospital in 30 days again. That is forcing major changes in the healthcare industry. And when you go from 12% to 19% of your population that's going to be on Medicare, that's going to have significant significant consequences, excuse me. Another piece of critical information about this is that hospitals now realize and are gearing more and more of their services towards older adults. I myself was on a task force to ask people in my community. I mentioned that I work at St. Mary Mercy in Livonia, and it is an older community, which I love. I was on a task force to help them find which people, how many people in the community would welcome a senior center and use it as their primary home, healthcare home. Is that what they're called now? Your healthcare home, something like that, where you're supposed to get most of your care from. One critical point of contact for customers in the healthcare industry is an emergency room known as an ER. I'm sure you've all heard the show ER. And that is because they're kind of known as front doors for a hospital. A significant proportion of patients who come to the ER get admitted. Something like 75% of people who come to an ER become patients there in the hospital. So that's their front door. That's where they need to grab people. What people are they interested in grabbing today? Seniors, because we're going to be, excuse that little faux pas, I'm not there. But those seniors are going to be 20% of the population in not too far distant future. Thus the advent of the senior ER. All that to tell you, that's why we have one. That's why it's here. My hospital was the first within St. Joseph Health System to have a senior ER. And we, as part of Trinity Health, were the first national organization to have one, and it was in Silver Spring, Maryland. Let me tell you what a senior ER is and how that differs from a regular ER. 3 major differences. Number 1, you'll find the rooms are private and they're customized. None of those curtains on those metal shower curtain rods. Clack, 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 clack. It will be quiet. You'll have a private customized room. You'll have specially trained healthcare professionals, different than the regular doctors and nurses. You will have a much more extensive screening going on than you would in a regular ER. They just don't have time for this screening in a regular ER. Fix your broken leg, you're off to surgery, whatever. Let's talk about those private customized rooms. How would they be customized? 75-year-old person coming in, what do they need? They need softer lighting than those harsh lights. They need bigger clocks. They need handrails. They need walkers. Patients can even request hearing aids and reading glasses. This and non-slip floors, because we certainly don't want them to fall and have to be readmitted. These are all things that would help patients feel more comfortable, more confident, and stay in tune. In addition, you're going to have specially trained clinicians, not just doctors and nurses like you have in any ER, but you'll also have social workers, and you'll have pharmacists, and the pharmacists will be evaluating patient medication regimens to make sure there are no contraindications, because as you know, many seniors are on multiple medications. Then you'll have a more extensive screening, looking for such things as depression and even dementia. I'd like to share a success story with you of an elderly female diabetic patient who had many repeat visits to the emergency room for elevated blood sugar levels. And the staff just assumed she was non-compliant with her medication. She just wasn't taking her insulin when she should. Well, the first time she went to a senior ER, a nurse asked her to draw a picture of a clock, and she could not. They realized she had dementia and had been covering it quite well. So they were able to place her where she needed placing to get her the support. Doctors and nurses can only do so much, but when you get social workers involved, they can find the extra care, the aftercare, and do better discharge planning, making sure that when a patient leaves, they have a support system outside of the hospital. It may even involve assisted living arrangements. But for whatever reason, they will find where you need to be and make sure that you have either a visiting nurse or you have family or somebody that will look after you so that you're not just going home as you would from a regular ER. Discharge planning involves making sure that all seniors leaving are cared for, as the reason I told you before, we don't want patients readmitted ever. And surveys have shown that patients who are treated in senior ERs are much more satisfied with their care and attention than they are in a regular emergency room. I have brought pamphlets, which I neglected to bring to the front here with me, but I will pass them out to each of you. They are from my hospital, St. Mary Mercy in Livonia. Thank you, Sharon. I want you to take these and remember to do this when you get home. If you have a loved one who is a senior citizen, or perhaps you plan on being a senior citizen someday, I do, make sure to check with the hospitals in your area and find one that offers a senior ER. These are important things, and this will be your reminder. You probably will not choose St. Mary Mercy in Livonia, but I do encourage you to find one in your area or the area of your loved one. It could make a crucial difference in the outcome of an ER visit in your future. Mr. Toastmaster.